Welcome, everyone. Received many requests for this topic on how to not use medications for the management of pain. So I'm really excited to spend the next 30, 40 minutes with you all. And I'm honored to include Diego Garcia, who's a licensed acupuncturist. He'll tell you a little bit more about himself, about a few slides in. We've got a presentation from him telling us a little bit more about what he does. But so you're going to hear from the expert themselves. And because these are modalities of pain management that used to be part of our weekly activities that kept us out of pain, but were eliminated during the pandemic. So I'd like to bring them back up to the forefront, have this resource available to you for if and when you experience some pain, you can come back to this presentation or remember some tidbits to help you. So let's talk about pain and some statistics. Approximately 70 to 85% of older people, defined as unfortunately all of us over the age of 55, in the US experience back pain at least once during our lives, with 36% experiencing a period of low back pain every year. 84% of people residing in a nursing home have some form of chronic pain, and they're on a pain medication or antidepressant. Knee, neck, and back pain are common in people over the age of 50. And the CDC, based on a survey in 2021, estimated 20.9% of US adults are currently living with chronic pain. So if you've experienced any form of pain, you aren't alone. This is a big topic. So how does pain occur? It's important to realize that in our medical world, we have definitions of different forms of pain. When the patient experiences pain, they're like, I'm in pain. But when we are asking questions, we're trying to distinguish whether it's nociceptive pain, inflammatory pain, neuropathic pain, or functional pain. I'll go into details about some of this, but not too much. Because the pain reflex is similar. So if we're looking at nociceptive pain, that is where you've had some type of trauma or injury, like a burn, getting hit, or even a vaccine, something that injures you. Sorry for the blurring. We have these receptors in our skin, which are connected to these nerve cells. And then the nerves send a signal to our spinal cord. So it could be in the mid thoracic area, if it's in the arm, or say you hurt your knee, it would be in the lower, in the lumbar area. And it sends a signal to the spine that then sends a signal up to the brain. And then your brain says, oh, I've got pain. I've got and then you have an emotional reaction, or you pull your arm away, or you run away from this source of pain. And it's also, if you can see, temperature sensitivity also, we have receptors for that. Inflammatory pain is pain due to arthritis or being cut on in trauma or an operation, and then that causes a cascade of inflammatory mediators also in our bloodstream that also get activated separate from the site of injury, which augments the pain cycle and may cause us to have pain further downstream from the site of injury. And that's important. So you could say you got an arthritis pain and your knee is flaring up, but then suddenly your hip is hurting or your elbow hurts or other parts of your body hurt. I've heard a lot about this due to the COVID vaccine. And that's because these other pathways are triggered, and then you become a little bit more inflamed. Still goes through that central canal, spinal cord, goes up to the brain, and that's how our brain recognizes that we have some pain going on. The pain, there is something called a pain cycle, where we have disease or pain, our muscles tense around that. Then we get a little bit more stress, we get upset, we get irritable, we get angry, depressed that we can't do what we want to do. And then that leads to poor sleep and fatigue. And then the just cycle continues. And it's exhausting, being in pain. And I call it the pain drain cycle. So let's go into some non-pharmacologic techniques. The reason I wanted to talk about that is that most of our pain medicines um, affect the brain here. So narcotics and muscle relaxants and everything tend to act in the brain and then kind of go backwards. And then, so of course, the side effects of all of those are sleepiness, and memory loss. And no one wants that. So trying to keep ourselves away from drugs, there's a whole host of treatments that can be offered that we're going to go into a little bit more detail. Physical therapy, massage, meditation, relaxation, aromatherapy. There is something, even psychotherapy. A lot of people, when I talk about that while you're in pain, it just is a closed door. Neurostimulation, including acupuncture, which Diego is going to go into it in a little bit more, yoga, stretching. Nutrition is just a one-liner, and some of the supplements, really, we're going to talk about some topicals. So physical therapy, many of you may recognize Andreas next door at Results or Water Sports Therapy. We also have physical therapy at Sharp Coronado Hospital. So physical therapy uses multiple different modalities. Many folks, when they complain of pain and I recommend physical therapy, they're like, well, I already do the exercises. Well, exercise is just one component of the tools that can be offered by a physical therapist. Some of them will give you some electrical muscle stimulation. Some will have some cryo or laser therapy, heat and cold machines. Manual therapy is a big component of physical therapy. Some folks will apply heat. Joint mobilization is a big part of it, helping you stretch and move in a safe manner. Dry needling, our guys don't do that, and we'll ask Diego to share a little bit more. Phonophoresis is use of ultrasound to help with pain, which is similar here. Some will give mineral oil therapy or essential oil therapy. Some will add in massage, teach you exercises, and hot pack therapy similar. So some of this is a little redundant here. Traction is used in physical therapy, and I know that at Results they use that. And at Water Sports, they actually use the swimming pool as a modality within their physical therapy to help joint mobilization and getting kind of bones off the nerves. So it's important to know that when we make a referral for physical therapy, that you can possibly even ask for some of these other treatments and say, hey, I heard there's some other things that can be done instead of just this exercise. Massage therapy. There is just a regular massage, but there's also medical massage, and that's based on some results. So if you are experiencing specific pain, you should ask for a medical massage so they can target the area of pain directly. Studies have shown that it manages pain, lowers inflammation, definitely boosts the circulation, sometimes will alleviate nerve compression, improve flexibility, and even promote, digestion. Traditional massage just focuses on relaxation without going into the other medical arenas. Sharp Coronado offers medical massage therapy. What about mindfulness, meditation, relaxation? And I added in Epsom salt bath into this section. So when you're in pain and suffering, the last thing you want to hear is be mindful and meditate and relax. But if you start being incorporating a little mindfulness, a little bit of meditation, and teach your body how to relax, it may help you stay out of pain. So if you bring in a little mindfulness into your day-to-day life on a good day, then when you're in pain and you implement some of those techniques, it may help relax muscle. It is not the source of pain relief all by itself, but if you're in pain, it will help take it down probably 1 or 2 notches. So it can bring the pain scale of 10 down to 8. We do know that meditation on a daily basis increases the telomeres, which is an aging gene in our body. And we do know that studies have shown that it decreases inflammatory mediators circulating in our system. I thought I should show you a picture of what float therapy is, so that if that is something that we talk about or recommend, this is what it looks like. You're in this kind of a jacuzzi pod, and 1,000 pounds of Epsom salts are put in, fresh for you. Every patient gets a different float. And what it does in this bath is about body temperature, and it eliminates the forces of gravity and allows kind of your muscles and bones to relax and separate and recover. It also, folks sleep really better, and they sleep in this pod. You can close the pod if you want some sensory deprivation. The Navy SEAL Foundation has given a contract to some local float spas in San Diego to help our Navy SEALs with their traumatic injuries. And so just FYI, this is something our Navy SEALs use for pain relief. So, and it's something that's a modality that's open to you all as well. What about aromatherapy in reducing pain? If you hopped on earlier, I shared with you the article that I pulled some of this information from. And aromatherapy does work in mostly for post-operative pain and obstetrical post C-section, and maybe a little bit during labor. It's hard to say just inhaling lavender, pain goes away, but it does help with headaches, muscle relaxation, sleep. Lavender is probably the most common aromatherapy that's used for relaxation. If you are getting a massage, you can request some of that. Ginger has been shown topically to decrease inflammation. I use it, ginger tea, when I tell people during cold and flu season to help reduce cough. And so the study that's being cited here is the knee pain. And when it's massaged into the knee, it improved or decreased stiffness. Lemongrass also has been used in arthritis pain, decrease headaches, and definitely for gastric ulcers. And if applied topically, can decrease swelling. Rosemary has been used to decrease muscle aches, improve memory and circulation. And eucalyptus commonly during cold and flu season. Essential oils that are used commonly are bergamot, wintergreen, peppermint, chamomile, a form of sage, clove, and frankincense. And Diego, when you talk about your herbals, if you use any of these, please throw them in. Psychotherapy, as you noticed in the pain drain cycle, we get depressed if we're in chronic pain. So sometimes having somebody to talk to get kind of that part out of your system, to vent, manage your stress, helps. We become extra cranky when we're in pain, and if we can just have somebody to vent to, that helps. There is a form of psychotherapy called cognitive behavioral therapy that can help people manage chronic pain by kind of addressing what the negative thoughts that are generated, decreases kind of our emotional response and helps us problem solve. Now, remember that there is a way that we can kind of extinguish pain. Many people have different thresholds for pain. Um, there are folks who can, bite the bullet, so to speak, and stitch themselves up if they're out in the field. And others will jump at, brushing a pine tree, and those pine needles affect them. So we have different kind of pain thresholds, and there are ways to kind of use our brain to decrease that pain sensitivity threshold. And with that, there is this formation of neurostimulation and TENS to help us with that. So this is over-the-counter muscle therapy where you put these teeny little electrodes on your skin to kind of stimulate the endorphins that are released at the skin to decrease our pain signal to the brain. And it's kind of like our own natural painkillers being triggered at the site. And they're relatively inexpensive now. We used to have to provide this at a physical therapist's office or by prescription. But now if you're in pain, you can just go grab it. And the higher impulses are things that are done medically, but the lower impulses is something you can try on your own. How about yoga? I was like going, how can yoga help with pain, right? Well, yoga includes some of the mindfulness that we talked about. A study published in Annals of Internal Medicine, which is a very reputable journal, among 313 people who had chronic low back pain, a weekly yoga class increased their mobility beyond standard medical care. And they found that yoga was comparable to physical therapy in relieving chronic low back pain. And this was cited by Harvard Health in 2015. It definitely improves our flexibility. It helps lengthen muscles in your backs, hips, legs, which kind of reduces stiffness, reduces tension, gets the bone away from bone, because when you're bone on bone and tight, you increase inflammation and pain. It increases our blood flow, which then helps deliver more oxygen and clears inflammatory mediators. Definitely improves our posture, which can then improper posture results in back strain, helps us get stronger. It may help neuron growth, maybe due to some of the mindfulness, and definitely reduces some of that stress. And now I'd like to introduce Diego, who will tell us a little bit about his practices of acupuncture and wellness. And then I'll come back for some other topics.
Hey, good morning, everyone. It's a pleasure to be here. Asha, thank you for the opportunity. I'm so excited to share about the benefits of acupuncture for pain relief. If we go ahead and go to the first slide. So acupuncture is an ancient Chinese healing practice. It's been around for over 2,000 years. It involves inserting very thin needles into specific points to promote healing. And the goal is to bring the balance back to the body by interpreting the body's needs through reading the pulse and then formulating a pattern of diagnosis, which then applies acupuncture points to potentiate the body's own healing processes. This very morning, I had a patient come in because he had some back pain actually. And after hearing his story about how the pain came up and what caused it to feel worse and taking his pulse, I asked him, hey, do you drink a lot of cold water? And he said, yeah, everything I drink is cold. I drink Spindrifts, I drink LaCroix, I drink ice water every day. I do ice plunges. And what led me to take this question was that there is a pulse that I was reading on his left side, on the radial artery. I'm sorry, on the right side. And the pulse was extremely tight in that position, meaning that the body is dealing with some tension relating to decreased blood flow and some fascial tension, which is a pulse that I often find a lot of people who have back pain and drank a lot of cold fluids. So that's an example of how Chinese medicine uses multiple inputs like the pulse and question answer and kind of palpation to figure out what the pattern is. Can we go to the next slide, please? So like I mentioned, acupuncture has been practiced for over millennia. It is now globally accepted into various healthcare systems. The World Health Organization and the National Institute of Health acknowledge the benefits, and many major professional athletes and sports teams keep acupuncturists on staff. And actually, California recognizes licensed acupuncturists as primary care providers in the state. So there's a growing trend of bringing back this ancient wisdom because it is very applicable to integrative care and it's very complementary to Western care. Next slide, please. So the Eastern mechanism of action, which you might be wondering, how does all this work? You may have heard of the words like qi, acupoints. Qi is a measure of change in the body. It's kind of what we use to measure whether the body can achieve its functions. We believe in acupuncture that qi flows through meridians or channels that are aligned with organ functions, and they have a pathway through which they run in the body. Whenever we have pain in Chinese medicine, the reason is because qi and blood are not moving efficiently or harmoniously. So they stagnate and accumulate and lead to pain. The needles are there to release the free flow of qi and blood and to help the body regain balance. The needles are placed in acupuncture points, which can be thought of as marketplaces where a lot of information exchange occurs in the body. By stimulating these points, acupuncture aims to restore balance, free flow of qi and blood, and promote the body's natural healing. From a Western sense, acupuncture stimulates nerves, muscles, and connective tissue. It is very much in the realm of neuroimmunology. The needle inserted causes a reaction by the body to address a foreign object, which leads to adrenaline increase and kind of a local histamine reaction. And then when the body realizes that it is not a threat, it kind of goes into a parasympathetic response, it calms down, and then, people often fall asleep on the table. I hear a lot of people snoring, which is funny thinking that they're asleep on a table with a bunch of steel needles in their body. But there is that effect of kind of ramping up and then going into a deep, deep, deep relaxing state. That relaxation can stimulate the body's own natural painkillers, which many of you have heard are called endorphins. And that local immune reaction leads to enhanced blood flow and promotes healing and actually overall reduces inflammation. So there's a great research being done on how the Western system understands acupuncture's mechanisms of action. The pain that I see most often in the clinic and the pain that responds well, primarily most of my patients come in because they have had little to no result in treating their back and neck pain. So this is unfortunately kind of like a last resort. They come to see me because they're at the end of the rope. They don't want to take medicine and they've tried chiro or massage and they're still in pain, usually chronic pain. I see a lot of people come in for some osteoarthritis, usually of the hands and wrists. I treat a ton of sports injuries, kids from 13 to 18 who are in competitive volleyball leagues and have injured shoulders and ankles and hips, as well as people in their, up to the 70s and 80s who are pre-operation for hip replacement or post-operation. And then I also see a lot of migraines and headaches because often those people don't get a lot of relief from the standard of care. And then, like I mentioned, with the sports injuries, a lot of post-operative pain. With acupuncture, I've seen people minimize the need for painkillers post-surgery and increase their overall recovery and the return back to active lifestyles. So the general treatment course for acupuncture, it's highly individualized. A typical course might involve weekly sessions over several weeks. Some very acute cases might require twice weekly treatment in the beginning. But the goal is to get you feeling well out of the clinic and back into your active lifestyle. I like to think of the word play span instead of lifespan. It's not just about how long you live, but how long can you live well? And I firmly believe that acupuncture increases your overall play span. Some patients opt for maintenance sessions to come in either monthly or every other month, or at the very least, come in between changes of the seasons, because those are times whenever our immune systems are being challenged. We have family stresses, etc., vacations, and acupuncture is a great way to get the body resettled into kind of who they are at the core. What to expect during the treatment? Well, the first session is generally a health history intake and an assessment, which is very similar to Western care. There might be some light needling if the person has not had acupuncture, just to get them a feel of what they can expect. For most people, acupuncture generates little to no discomfort. Along with the needles, we might use acupressure, which is manual pressure on acupuncture points, as well as cupping, which is the application of suction to various body areas, which encourages blood and lymph flow and promotes space between fascial layers. Gua sha, which is the gentle scraping therapy that frees fascial tissue and muscle tension and promotes blood and lymph flow as well. I also utilize infrared and red light therapy, which uses heat and specific red wavelengths that promote blood flow, reduce inflammation, and support cellular health. And my sessions are conducted in my clinic, which I'm in now in San Diego. And it's a very calm setting. I have a running fountain, which you might hear in the background. And most people leave feeling extremely relaxed and rejuvenated. And like I said before, many fall asleep during treatment. So what I love about acupuncture is that it looks at your whole person. It is a whole being therapy. It doesn't just mask symptoms. We try to look at the root cause of the person's pain or illness or disease, and we aim to treat the whole person. By addressing the root pain of cause, we can promote long-term health. Acupuncture can help with pain, but it offers so much more than that. It can help with metabolic conditions like, pancreas issues, digestive issues, sleep issues. It can help deal with emotional issues as well. And by addressing the whole person, we provide overall well-being and help people feel, more like their healthy selves. The modern use of acupuncture is increasing. So many sports teams incorporate acupuncture to enhance performance and speed up recovery. We're seeing a rise in use amongst professional athletes. You can see the increasing trend, the purple to the salmon color and the red. There are growing bands of utilization. The military also uses it to treat pain and PTSD among service members. In fact, there's a protocol called battlefield acupuncture, which is just an ear therapy that's done whenever we need to decrease pain and maybe don't have access to medication. And then insurance companies are also increasingly covering acupuncture due to its proven benefits. And as you can see, the last graph is just California. We are increasing California licenses for acupuncture because there's a growing demand for this type of therapy in our state, let alone nationwide. So I'd like to do a little demonstration with you if you guys are interested. There is a great point here called large intestine 4. In Chinese, it's called Hegu. And this pressure point, which I'm going to show you how to massage, helps with headaches, especially tension headaches and migraines. It can reduce toothache and facial pain because that channel runs across the upper teeth. And it can also ease neck and shoulder tension since this channel crosses the shoulder and the upper trapezius. It is contraindicated if you're pregnant. So if you're pregnant, please don't do this because it can initiate or promote contractions in the uterus. So the way you want to address this point is you can just pick one hand. You're going to take the opposite thumb and place it in the middle of the bone after the big knuckle on your index finger and the wrist. So go between the half space there, the midpoint. You're going to go just off the bone towards the webbing of the finger, and you're going to use the index finger of the opposite hand to give the thumb a backing to press into. You're going to kind of dig your thumb in and find in a small circular motion, maybe a little tender spot in there that you can kind of hone in on. That is most likely going to be your acupuncture point or your acupressure point. And you're going to rest your hands on your lap if you can, and just push that thumb in firmly. It should be very, very slightly uncomfortable. If you have a lot of neck tension or are prone to headaches, or you might be very tender in this point, it might not require much pressure at all. But just go ahead and give like very gentle circular motion massage for about 30 seconds and see if you can notice on that arm whether the shoulder relaxes, whether the neck relaxes on that side, or whether you feel like your head becomes less heavy or more open. That tenderness that we are applying through acupressure is a medicine that you have access to at all times because you have fingers in your body. It's not as effective as acupuncture because it doesn't elicit the immune response to the same degree, but it is a great therapy that you can lean into. Yeah, it is very relaxing. Yeah, it's one of the four gates, like Asha is saying. So you can check that out if you have a headache. You can play with that and kind of dig into it and see if it gives you some relief. All right, next point, please. Okay, so some frequently asked questions that I get. I don't, people say I don't like needles. I hate getting shots. I don't want to do acupuncture because it's going to hurt. The truth is that most people feel minimal discomfort because the needles are very, very thin. They're as thin or thinner than a human hair. They're all sterilized single-use needles that are discarded safely after usage. So when acupuncture is performed by a licensed practitioner, it is safe and it is very, very low risk of infections or other issues that can be found when you're using something more invasive. How many sessions are needed? Well, it depends on the person. I find that a few people feel benefits just after a few sessions, but the treatment course depends on how long you've been experiencing your condition. Generally, the longer you've had it, the longer it takes to treat, and also your age. The younger you are, the faster the body responds. If you're a bit older, the body needs a little bit more restoring and strengthening, and it responds a little bit more slowly. And does it replace medication? It does not. Acupuncture can reduce the need for medication, but patients should consult with their doctors before making any changes, including starting acupuncture. Acupuncture works well as an integrative therapy along with Western healthcare. And lastly, will my insurance cover it? A lot of insurances do. You'd have to kind of call and figure out whether your individual insurance covers it. I'm happy to help you discover that if you would like to try it out. And then for conclusion, I just want to say that acupuncture is a time-tested, holistic method for managing pain. Its integration into modern healthcare highlights its value. I encourage you to consider acupuncture as a complementary approach to pain management, and I deeply thank you for your interest in acupuncture and for the time listening this morning. In the next slide, you can see some contact information on how to get in touch with me via email. You can also check out the website. You can call, and you can see where I'm located here in Hillcrest. And yeah, I'm happy to answer any questions if anybody has any. Thank you, Asha, so much.
Thank you, Diego. This was terrific. Please stay for the rest of the slides and we'll open it up for question and answers at the end, if that's okay with you.
Will do. Thank you.
So thank you for that terrific detailed discussion on acupuncture. And I think displaying the pressure point and having us work through it was really important. And I'm sure you have many other tricks up your sleeve. So supplements are in kind of the semi non-pharmacologic. I just wanted to touch on it, that I kind of think of it, because of my holistic background, more as a pharmacologic treatment, because it interacts with many of our current medications used for the heart or something else. They are not FDA approved for pain. And there really aren't very many oral supplements that you can swallow that take care of pain. The only one that I invite you to explore is the turmeric session we talked about a couple of years ago on YouTube. And that does have anti-inflammatory properties, but it has drug-drug interactions. So just don't start it without talking to me. So that's all I want to say about the supplements. Topical therapies are some things that we forget about. And I want to give you a whole list of things to perhaps keep in your cupboard, because you just don't know when you might overdo it on a walk or fall down or be bike riding and need some pain relief or some anti-inflammatory treatment. So We do have some topical non-steroidals. It does fit into the drug category. However, since it's over the counter and very commonly available, it just seeps through the skin and is not absorbed systemically unless we keep it, unless we apply it anywhere above the belly button and in below the neck. So I do not want any of these topicals in that region because I don't want it near your heart or your stomach. So topical nonsteroidals can be like diclofenac, Voltaren gel, ketoprofen, or even topical ibuprofen. Those are all nonsteroidals, and we've talked about that before. If we swallow them, they can interact with our kidney function and raise our blood pressure. However, topically, they're considered fairly safe. Capsaicin, we used to prescribe that. That is a derivative of hot chili peppers, and it is similar to the TENS unit, maybe even a little acupuncture. It releases, it interacts with the receptor on our nerve cells in our skin called the transient receptor potential vanilloid 1. And it has been shown to be very effective in certain types of burning neuropathic pain. It's available over the counter. So it's kind of like you replace one pain with another. Think about the neuropathic pain of shingles, and it helps with that. Aspirin is commonly found in aspirin cream and Bengay, and we did a whole conversation on aspirin, and the topic is on YouTube. It is an anti-inflammatory and can help, but you can overdo aspirin cream, and that does get absorbed, so please be careful with that. There are what we call counter irritants. Those are like icy hot or biofreeze, where we heat cold and change the sensitivities on our skin to help extinguish pain. Menthol and camphor also. One of my new favorites is this cream called Active Again. You can get it for about $25 at Results or on Amazon. It's got menthol and some other topical essential oils. So combined, it acts as an anti-inflammatory and helps with pain. Topical anesthetics, this is considered pharmacologic, lidocaine. However, you can find it now in creams, gels, sprays, patches at the drugstore. It can buy you some time until you see me. It's good to have around. So if you do have, say, a burn, taking the turkey out of the oven, you can put some of this on. And you know that pain's going to go away. But it'll help you get through your Thanksgiving evening. Nitroglycerin, we're not going to talk about, but it does have some local conversion to nitric oxide and can be used as an anti-inflammatory. It improves blood flow to the area, but you can't really find this very commonly. And I actually don't use this for topical pain relief. Here is a topic that many people are talking about, ask about. When CBD came out, what I found was grandchildren were giving it to grandparents. So they were skipping their parents and giving it to grandma and grandpa who are 90 years old. And it is a cannabidiol product. So it is a byproduct of the cannabis plant. Supposedly won't get you high, but can cause drowsiness. Well, that means there is a psychoactive brain component if it's absorbed. In my 90-year-olds were applying it on their back or their knee, but you could see some glassy-eyed effect and sleepiness. So if you apply it enough and in a higher concentration, it did have an active component that got absorbed because the skin is extremely thin as we age. And some CBD products have up to, 0.3% THC, which is the active component of marijuana and gets people high. Does it help with arthritis? Well, there are animal and some very small human studies that have suggested that it has some anti-inflammatory properties, but we don't have any other validation trials just because this product was only just recently legalized, so there's lots of studies being done. Many people find that it helps with sleep or anxiety reduction and then secondary pain relief. And that's because it gets to your brain. And so, is it safe at this point? Very little is known. It can cause liver damage and fertility issues. We do know that marijuana can do that. It has, in terms of its science, there are potential drug-drug interactions of CBD, especially if you use the oil, the tincture under your tongue. Interacts with Advil, Aleve, Tylenol, steroids, some of our Xeljanz, which is used for RA, Celebrex, Tramadol, interacts with a slew of antidepressants and certain medications used for fibromyalgia, including Lyrica and Neurontin. It may interact with warfarin. And we don't know, since these are an unregulated compound, how much THC is in there. So that's why it's tough to say it's safe. What about cannabis? A lot of people are using marijuana. Um, there are three main components of cannabis that are cannabinoids, terpenoids, and flavonoids. There's over 100 different forms. And the main one that's the active component, we talked about CBD, and then the second one is THC. More people, historically, everybody's paid attention to the getting high component, but we have very little studies on the medicinal use, except for in its activities in reducing seizures and anxiety. There are pain relieving components in there. And we do have an endocannabinoid system and receptors in our body. So that's why we do have an impact in metabolism, appetite, mood, and pain perception. Just don't know enough about it. There was a Wall Street Journal article last week showing that there's risks of mold growth with these products, and people have gotten fungal infections in their lungs if you're inhaling this product, especially if you're working with it or growing it. We do know more and more studies are showing young people are getting depressed. We're also seeing long-term effects on memory and mood with use of regular THC or marijuana. So if it goes to the mind, it's something even like Benadryl. I caution against it. And the CDC agrees that we need more research on this. And this was just published on the CDC website in February, that there's limited evidence that it works in pain. I think it extinguishes the pain sensation in the brain, and we should just lump it in there as with our narcotics and our benzos. So with that, I'd like to open the floor for some questions. And I thank you, and I thank Diego for joining us today. So without any questions, let me just go into a couple of announcements. And if you come up with questions, please let us know. Next week, we are going to be doing some renovations in the office. So we're going to have the entire office painted. We're around, and definitely call, text, email. But I'm not going to have patients scheduled. I can do some telemedicine if you need, but text or email is best, because the workers are going to be there. They're going to be disconnecting things. Everything's going to be taped up. But this is good because it'll make the environment better for all of you. I also wanted to let you know that there is a cold and flu bug this week. I've isolated a couple of folks with human rhinovirus. So it looks like it feels like cold and flu, sore throat, runny nose. You feel bad all over. Maybe you feel like you have COVID, but it seems like we've got a common cold virus circulating, human rhinovirus. So make sure you have your chicken soup and vitamin C and um, all of the cold and flu meds around, so that when you feel bad, you don't have to run to the store. There's also a new COVID flu home test kit. So that may be useful for you to do so, because those are the only two medicines we have to treat viruses. And if one of those is positive, we can give you that medicine. Do it, test yourself within the first 24, 48 hours so that we can get the meds on board. And with that, I thank you for your attention, and I'm going to stop the recording.